Hi, my name is Clive Gallagher. I'm a plastic and reconstructive surgeon with a special interest in gender affirmation surgery. So I've been asked to do a video about what to expect after transmasculine top surgery, so female to male top surgery. So in this video, I'm going to focus on our masculoplasty patients. So this is our technique of doing top surgery. It's a lot like a double incision with a free nipple graft technique. I have another video talking about what's specific and what's different about masculoplasty. So the majority of our patients will undergo masculoplasty, and here's what to expect afterwards. So first things first, when you wake up after surgery, we put a lot of effort into making sure a patient has as little pain as possible. We know there is research showing that if we get in early with our pain relief, oftentimes a patient's course after surgery will be a lot easier. So we use a lot of what we call local anesthetic, which is similar to what the dentists use. However, we use a long-acting one that can give you up to 72 hours of pain relief. So oftentimes once you come round from surgery, the pain is really not that bad, and if you do have any sharp pain, our nurses will treat that very quickly, usually with a shot of pain medicine, which kicks in very fast. So really not much to be worried about there. When we survey our patients, most patients scored their pain at about 4 out of 10 on the day of surgery when they're headed home. And of course, about 90% of our masculoplasty patients will head directly home after surgery. So usually they'll hang out with us recovering for about 2 to 3 hours afterwards and then head home. So when patients head home, you're usually kind of bent over like a little man or like a T-Rex for the first day or two. So you're not completely debilitated. You are able to walk around, you're able to make it to the bathroom. Most patients can do that fine by themselves. But it's certainly recommended that you have someone with you at least the first night, and it's sensible to have somebody with you for the next few days. So in general, the average time off work after masculoplasty is 2 weeks. I've had 1 or 2 patients go back to desk jobs, or students go back in about a week, but usually you're not able to go back to work or driving for about 2 weeks after masculoplasty. So in the first few days, you're at home, you're feeling gross, you're bloated because your body retains a lot of fluid after any sort of surgery, because your body knows, uh-oh, there's something has happened here and I'm going to need to hold on to all the fluid I have. So patients will feel that in their ankles, definitely their belly will oftentimes bloat out, and it's very common to gain 10 pounds right away after surgery, even in cases where we've taken a lot of weight off from the breasts themselves. So that's really common. I always say surgery just makes you feel gross. You don't feel like yourself. We do allow our patients to shower usually about a couple of days after surgery. Most guys don't feel up to it for about 48 hours after surgery, so that helps a lot in making you feel less gross. But again, it's totally normal to feel just icky for the first full week after surgery. So then usually about 6 days, we'll come back, take the bolsters off, do the nipple reveal. I have videos showing that, and then at that time we'll free you up from the pressure garment. We've been through a lot of different garments, and this is about the 6th one I think we've been through. Most guys feel it's the most comfortable. I always say to patients, you're best wearing it 24/7 if you can. You're best sleeping in it, but if you need a break from it, if it's just digging into you, absolutely liberate yourself from it. We don't want you to be in pain and then put it back on again later on. Eating, once you're able to eat and you're not having any nausea or vomiting after surgery, which again, we do a lot of things to help prevent that. Sometimes put a little patch behind your ear or give you nausea medicine. Once you're able to eat, you should be able to go back eating whatever you like. We like to keep things really simple. One of my main rules for patients is if it hurts, don't do it. So usually your body's got a very good safety mechanism, and it's very rare for patients to accidentally injure themselves. So if you're stretching for something or you pick something up and you get a pain, that's your body's way of telling you too early, and so you back off a little bit. So that's the recovery in the first few days after surgery, and I'll do another video about what to expect then subsequently once the bolsters are off and we're dealing with new nipples and all the other things that come in the next few weeks after surgery. I hope this is helpful.